Measles, once declared eliminated in the U.S. back in 2000, is making an alarming comeback. The CDC reports more than 170 confirmed cases so far this year, spanning 9 states. Notably, none are linked to international travelers, meaning the virus is spreading here at home. Last year, the U.S. saw a surge with more than 2,200 cases, the highest in decades, and it comes as a time of growing vaccine skepticism. Joining us now to break down what this rise means and what parents should do about it is Dr. Dean Blumberg, professor of pediatric infectious diseases at UC Davis Health. Good morning to you, doctor. Thanks for joining us this morning.
Yeah, good morning.
All right, let's dive right in. What do parents need to know about measles?
Yeah, a lot of parents think of measles as just fever and a rash, but many don't realize that worldwide, more than 100,000 children die of measles every year. So it can be potentially fatal, it can result in hospitalization, and your child can be miserable with measles.
And so far, we've heard about the outbreaks in Texas, South Carolina. They've had pretty bad ones. So how concerned should we be here in California?
Well, in California, fortunately, we still maintain a high childhood immunization rate, but measles is one of the most infectious diseases known to humans. So any case that's introduced into a community can result in local spread. And we know in California, even though overall our immunization rate is high, there are pockets of vulnerable communities that have relatively low immunization rates. And by low, I mean less than 95%. So it doesn't take many vulnerable people to result in transmission.
Let's talk more about that immunization, prevention, vaccines. How significant is that in the fight to tamp out measles?
Well, a measles vaccine is extraordinarily effective, with 2 doses being 97 to 99% effective. So it's our most important tool that we have to prevent transmission. And yet we know that immunization rates have been lagging for years, and especially over the last year, they've really gone down in many communities.
And just more broadly, this comes at a time of heightened vaccine skepticism. Your thoughts on how the CDC, the health department led by Robert F. Kennedy Jr., who is a noted vaccine skeptic, how they're handling this issue?
Yeah, so vaccine hesitancy has been brewing for years and been increasing, but with the current political appointees to the CDC, the messages have been confusing at best. And we know the one thing that's most important for instilling confidence in vaccines is clear and consistent messaging. So this has resulted in a lot of confusion, not only among parents, but among healthcare professionals also.
Bottom line, measles vaccine, COVID vaccine, flu vaccine, all safe and effective?
They're all safe and effective and the best way to protect your child.
Dr. Dean Blumberg, thank you so much for your time. We appreciate it.
Thank you.